So today we're going to be going over the skeletal unit, more specifically the axial features. So last week we covered the bones, general bones, and then today or this week we're going to go over the axial features of the skeletal unit, and then next week we're going to go over the appendicular features. So by today, we should be able to identify which bones are going to be axial, which are going to be appendicular, but we're only going to be focusing on the axial today. So we should be able to identify the individual bones of the axial skeleton and know their features. And then this is really important for all bones unit is to be able to cite the bones, whether they're right or left bone. And eventually the features on those bones, when we discuss those features, those are going to be really important when we discuss muscles, because most of the time those are going to serve as attachment points. So this is useful information when we go over the muscles. So for the skeletal regions, again, we have axial and we have appendicular. Axial is everything here in beige. That includes the skull, ribs, and the vertebra. So skull, ribs, and vertebra. And then the appendicular is everything else, which includes your pelvis or pectoral girdle and pelvic girdle. So your pectoral girdles over here, your shoulders, pelvic girdles, your hips, and then your arms and your legs. So today, those are the terms we're going to go over. I'm not going to go over like one by one right now because we're going to cover all those. But those are the terms you're going to have to know for this specific slides. So to start with the skull, we mentioned this last week, but the skull actually has 22 bones total. Those 22 bones are divided into 8 cranial and 14 facial. So this part over here has 8 bones, and this part over here has 14 bones. So together they're 22 bones total. We have 8 paired bones and 6 unpaired bones. Again, paired means we have 2 of, 6 means we only have 1 of. So bones bones are fused at those immovable joints. Those are called sutures. So sutures connect like 2 different bones together, which again, those are not joints, so those don't move. And also we have cavities and sinuses. So cavities is like your orbital cavity, which your eye socket or like your eye sits in. You have your nasal cavity, so those all are cavities. So we're going to start with the cranial bones of the skull. So again, the skull is like a protective case. So it case and protects the brain. And then we have another layer called the meninges, which again, we're going to be covering when we cover the brain at the end of class. So brain is separated from the bones by the meninges, which is a protective membrane. Flowing from anterior, so anterior to posterior. We have the frontal bone, and then going down, we have the ethmoid bone. Then going here, we have the sphenoid bone, and then we have the parietal bones. We have one here, one on the other side, and then we have the temporal bone over here. And then the last one, we have the occipital bone at the back. So starting with the frontal bone, which is an unpaired, meaning we only have one of, so this is your frontal bone. It forms the superior margin of the orbit. Again, the orbit is the orbital cavity, which is your eye socket. So it forms the superior margin, superior meaning above, and also forms the anterior and superior aspect of the cranial cavity. So the cranial cavity is where like your brain sits in. So it forms the anterior slash superior aspect. So if we look into the frontal bones, if we look over here more specifically, you see those 2 holes. Let me zoom in. So see those 2 holes over here? We call these anatomical terms foramen. So this is the supraorbital foramen. It's supra, meaning above, orbital, which is the orbit of the eye, foramen, which is a hole. So this is called the supraorbital foramen, which basically translates to a hole above the eye. So this allows for the passage of blood vessels and nerves inside. And then we also have the frontal sinuses. So a sinus is basically a socket full of air. So over here, over here, this would be your frontal sinus in your frontal bone, which is again filled with air. So we have two of the supraorbital foramen. We have two of the frontal sinuses, one here, one on the other side. So those are paired, and those are located on the anterior portion. Next bone we have is the ethmoid bone. So this is what it looks like over here, and this is the tip. So this is where it sits. So this is the top view. And if we want to look over closer here, so it sits right here. So this would be your ethmoid bone. So it goes into your nose all the way up. So it kind of sits underneath, but more into the anterior part of the frontal bone. So it forms the medial margin of the orbit. So again, part of the orbit, it forms the medial part of the orbit, the roof and the walls of the nasal cavity, and the superior aspect of the nasal septum. So when people break their bones, sometimes they also break that bone over here because this forms the superior aspect of your nasal septum. So when we're looking at the bone over here, you'll see the first thing is something called the crista galli. So the crista galli is this pointy part over here. So this pointy arrow that looks over here, this is called the crista galli. So this is more of an anchor. So this anchors the meninges. Again, the meninges are this protective membrane that protects your brain. We actually got 3 different layers of meninges. So the crista galli, again, this arrow looking thing, bone structure over here, this anchors the meninges. So it's more of a crest on the superior margin. So this is the superior margin. It looks like a crest. And the function is that it would anchors the meninges. This whole structure over here, this is called the cribriform palate. So over here, this whole structure is called the cribriform plate. So this plate includes the crista galli. It also includes the olfactory bar, the cribriform foramina. Still those little holes, those are called the cribriform foramina. This helps with your olfactory receptors. So the way you can smell, those have receptors and eventually nerves. So you have the olfactory bulbs, which are the nerves for scent. So you have receptors and you have nerves that are in this cribriform plate and this cribriform foramina, which again helps with the sense of smell by having nerves and having receptors for that smell. We have this perpendicular plate, so this long road of a bone. This forms the superior 2/3 of the nasal septum. And again, some people, when they break their nose, sometimes they break this part of the bone. So again, this is the ethmoid bone, but this part specifically is the perpendicular plate. So this is a vertical plate that forms the superior 2/3 of the nasal septum. And then we have something called the nasal concha. We have superior nasal concha, middle nasal concha, and inferior nasal concha. So the inferior nasal concha is not on the ethmoid bone. So the ethmoid bone only has the superior nasal concha and the middle nasal concha. So though this is the nasal concha, this bony structure over here. So this is a projection that basically has all these, again, cells in it, and this helps increase the surface area within the nasal cavity, which again helps with the sense of smell. So this is again why we can smell a different range of odors, because we have a big surface area over here. So we have the superior nasal concha, and then we have the middle nasal concha, and we're going to show you the inferior nasal concha on a separate bone. So yeah, superior bony projection that helps increase the surface area within the nasal cavity is the most superior, and then we have the middle. The inferior nasal concha is going to be on a different bone. So again, what are those? Those are projections, and those are cells. And again, the way it's like wide is to increase the surface area so we can smell better and have a good wide range of smells that we can smell. Next bone is the sphenoid bone. So this sphenoid bone, it looks like it has wings because actually it does. It has something called greater wings and lesser wings. So first of all, the sphenoid bone forms the posterior wall of the orbit. So the posterior wall of the orbit, again, orbital cavity is where your eye sits. It also forms the floor. See, this is the floor of the cranial cavity. So those wings, it had the greater wing. So this is the greater wing, and then we have a lesser wing over here. So greater wing, lesser wing. So the greater wing forms the middle floor of the cranial cavity. So this bigger wing forms the middle floor of the cranial cavity. It also has a lot of foramen and orbital fissures, which we're going to go over in the next slide. Uh, also, I mean, you can kind of see here, see those foramen. Again, foramen are holes. Again, the more anatomical term is foramen. And then we have lesser wings. So this is the lesser wing. Those are more medial and superior to the greater wings. Again, medial meaning more to the middle, superior meaning it's above the greater wing, and those help form the orbital fissures, which again, we're going to go over in the next slide. So when we're looking at the sphenoid bone, we have superior orbital fissure. So if we zoom in here, so this is called the superior orbital fissure, and this is the inferior orbital fissure. So superior is because it's above, inferior because it's below. So those are two fissures, and we have the optic canal over here. So this optic canal is where the optic nerve, which is the nerve responsible for vision, it goes through this optic canal. And then we have the, again, superior orbital fissure and inferior orbital fissure. And those fissures are, again, fissures like a crack. It's found in the posterior wall of the orbit, and this, again, allows for the passage of nerves and blood vessels. And since this is superior, it would point superior and more vertical. But this one, it kind of more diagonal and more inferior, but it has the same function. So this allows for the passage of nerves and blood vessels. And this is, again, found on the posterior wall of the orbit. Again, the optic canal is the small canal over here. So this is, again, located on the posterior portion of the orbital cavity, and allows for the passage of the optic nerve, which allows for vision to happen. Next, we have something called the scylla turcica. So this window over here, so like this window over here, we call this the scylla turcica. So it looks like a saddle. So it's a saddle-shaped structure. It lies in the medial portion. The reason why we want to mention this, because within this scylla turcica, we have a fossa. So a fossa is more like an indentation, or like a bowl looking like area. So this is a deep indentation in the scylla turcica, and the reason we mention this because this hypophyseal fossa is where the hypophysis or the pituitary gland would actually sit. So your pituitary gland, which is a gland really responsible for secretion of a lot of hormones, sits inside this socket. But again, anatomical term, this socket is called the fossa. So this is called the hypophyseal fossa. And it's called the hypophyseal because the pituitary gland is actually called, I mean, it's called the pituitary gland, but it's also called the hypophysis. So that's why we call this the hypophyseal fossa. And again, this whole structure of like this uh, rectangular or square looking structure is called the scylla turcica. So within the scylla turcica, which is a saddle-shaped structure, we have the hypophyseal fossa, which is the fossa where the pituitary gland or the hypophysis would sit in. Next, we have the parietal bones. Again, we have two of right and left. Between them, we have a suture that connects both right and left. We call this the sagittal suture because it's sagittal. And this forms the superior and lateral aspect of the cranial cavity, and it's held together by the sagittal suture. It's a pretty easy bone. Next, we have the temporal bone. So the temporal bone, your temples, it's right and left. Again, we have two of. So let's start with the most obvious thing, this pointy bone over here. This is called the styloid process. So this arrow or pointy bone sits right here. So this serves as an attachment point for a lot of muscles. So a lot of muscles would just attach to this styloid process. Right next to it, so this more, not really pointy, but another projection. This is called the mastoid process. So you can actually palpate it, meaning like you can actually feel it. If you put your finger here, you can actually feel the mastoid process. So it sits right at the back, behind the ear, right over here. So it's a prominent bump. It serves again as an attachment point for muscles, can be palpated behind the ear. And then next we have the zygomatic process. Last week we talked about the zygomatic bone, which is your cheekbone. So your zygomatic bone connects the temporal bone through the zygomatic process. So this arm over here. So this is called an extension that connects to the zygomatic bone. So it connects all the way here. So if you look here, I don't know why it zooms this much. So over here, you'll find this is your zygomatic bone. So it connects to the temporal bone using this zygomatic process. Next, we have, again, if we go down from the zygomatic process over here, you'll see like a shallow uh, indentation, which is, again, it's the fossa. We have called this the mandibular fossa. So it's a depression on the lateral side of the bone. It's a connection point for the mandibular condyles. Again, mandible is another word for like mouth. So mandibular fossa, which is going to be a connection to the mandible, specifically through the mandibular condyles, which we're going to go over when we go over the facial bones. Next, we have the external acoustic meatus. So you see this canal over here. So this is the external acoustic meatus, and it's external because most of the times when we have something called external, we also have an internal. So this connects to the inside, and I'm going to show you in a second what's the internal acoustic meatus. But external meaning it's on the outside, and then there's internal acoustic meatus, which is basically a canal that funnels sound. So again, it's acoustic, meaning it has something to do with sound. So it funnels the sound into the ear. And then on the inside, we have the internal acoustic meatus, which is the end of the canal located on the anterior portion. So if you look here, you'll see the internal acoustic meatus. So we have the external on the outside. It funnels the sound, and the sound goes through this canal into the internal acoustic meatus over here. So next we have two canals, or one canal, one foramen. We have the carotid canal, which is not in the picture here. So from the name, if you're pretty familiar with the carotid artery, so it's formed by the temporal and the occipital bones. So temporal, which is the one we're covering right now, and the occipital, which is this green one. It allows for the passage of the internal carotid artery, which is the main artery that's responsible for carrying blood into the brain. So next we have the jugular foramen. Again, if you're familiar with the jugular vein, so this is the vein that takes blood away from the brain. So both carotid arteries are really important artery because it carries blood into the brain, and the jugular vein is a really important vein because it takes blood away from the brain. So if you look over here, this would be your jugular foramen. This slit over here. So it's formed again by the temporal occipital bones. It allows for the passage of the jugular vein, which takes blood away from the brain. Next, we have the occipital bone. Again, we had two of the parietal, two of the temporal. The occipital, we only have one of. So it forms the posterior aspect of the cranial cavity. So it's all the way at the back. It meets the parietal lobe at the lambdoid suture. And we covered this last week. Why is it called lambdoid? Because lambdoid is meaning like it looks like the Greek letter lambda. So they call it the lambdoid suture. And for those, we have condyles. So let's address the big one first, this big hole over here. So this is the biggest foramen we have in the body. That's why we call it the foramen magnum. So it's the large hole at the base of the skull, and this is what the spinal cord would go through. This is why it's so big, and it's the biggest hole that we have in the bone. We call it the foramen magnum. The large hole at the base of the skull allows for the passage of the spinal cord. Next, we have the occipital condyle. So those are condyles. So again, when two bones kind of meet together, they attach or form the joint through those condyles. So those are rounded knobs at the inferior portion. Again, inferior means the bottom. And those are important because those connect to the first cervical vertebra, which is C1. If you guys remember from last week, C1 is called the atlas. C2 is called the axis. So C1 connects to the occipital bone, or basically connects to the head through this occipital condyle over here. So we have the occipital condyle, we have the foramen magnum, and then over here we have the external occipital protuberance, which I don't think you have to know the function of. But next we're going to go over the facial bones. But that basically sums up all the bones we have in our skull.